It's great to have you with us for Dermtube meeting coverage from Maui Derm. With us is Dr. Andrew Kaufman from California. He spoke here about how to really simplify some of the complicated flaps, something you know a lot about as Iron Surgeon from the ASDS.
Thanks, Joel. I'm actually the Surgeon General of the Iron Surgeon competition, but I'll take that as well. Thank you.
So take us through a flap, some of the nuances for something like a flap on the nose, flap on the ear, some of the flaps that you've published.
So what I've tried to do is to try and make flaps less intimidating. There are a number of flaps which are workhorses or very useful in facial reconstruction that are intimidating for the usual dermatologic surgeon, and so there are some simple little things that you can do to make them a lot easier, as far as everything from how you plan it to how you perform and execute the flap.
So bilobe is our workhorse flap on the nose. You have some special little tricks that you do for the bilobe flap beyond the Zitelli modification.
Sure. So the bilobe flap is a really good example of that, and the bilobe flap is something that's really useful. I like to use it for defects on the side of the nose from about 1 centimeter to 1.5 centimeters. And the trick is, again, it's a two-lobed flap, and the trick is to think of it as a heart-shaped flap. That's one thing. So that way the size of the lobes are going to be the same size as the defect, and they need to be the same distance apart. So it's basically a 90 to 100 degree angle between the defect up to the second lobe. So that's the first thing. Think of it as a heart-shaped or cordiform. The second thing is, after you've incised it and you need to adequately undermine it, and I'd say in my years of doing this, people have the most problems as far as undermining an adequate amount around the tertiary portion of the flap so that they can get the flap all the way down. So that'd be the second thing. And then the third and fourth things would be to close the tertiary defect first. That's where the second lobe came from, and that causes the two other lobes to fall into place. So you do that, and then the final thing is to cinch together that little area between the two lobes, and then after that it's just a matter of trimming down the flaps and removing the tricone.
In terms of looking back to my fellowship, I always hear two things going on when I'm actually doing a bilobe flap from my fellowship director's mouth. One is make sure to undermine extensively that recipient site, and then in terms of where the movement is going. And the second thing is make sure that that second lobe, the tertiary defect, is completely vertical so that you can sort of avoid any pulling on the eye itself.
Well, that's something that, John Zitelli has particularly, been talking about lately, is trying to make that second lobe more vertical. I'm not sure it's as important as making sure the distance between the two lobes and the defect are exactly symmetric so you don't push down or lift up on the ala. But yeah, undermining around the surgical defect will help decrease trapdooring or pin cushioning. And then also undermining adequately around where you took that second lobe from will make it so much easier to close that defect and easier to reach down with those two lobes. So yeah, that's really important.
And then last year you and I were at a meeting together in Florida, and you really showed some nice ear defect restoration basically, and you had some extensive undermining above the level of the cartilage and just pulling the skin over, and I've incorporated some of that into my practice. But give us some tips on significant ear reconstruction.
So what you're talking about primarily is for like a helical rim advancement flap, and so that's for defects that are limited primarily to the helical rim. And I think the two most important things about doing a helical rim advancement flap are, I prefer to maintain the entire pedicle on the medial or posterior aspect of the pinna, and I think it's really important to take your incision all the way down to the lobule where you excise a tricone. So you incise all the way down the helical sulcus to the lobule where you cut out a tricone, and then you reflect the ear forward and undermine on the medial aspect of the pinna all the way down to the postauricular sulcus. Now if you do that, the one thing is, by keeping all of that intact skin on the back of the ear, your vascular pedicle is much larger. And then the other thing is, by going all the way down to the lobule, that's where the loose tissue is. There isn't loose tissue along the helical rim. So if you stop short, basically what you're doing is you're stretching the skin on the helical rim. If you go down to the lobule where the loose skin is, for most of us, and you do your little back cut or tricone, you've released all of that loose tissue to help close that surgical defect.
Excellent. These are great tips from the Surgeon General of the ASDS, and I must admit I think of Dr. Kaufman very frequently when I'm doing little rotation flaps on the lower lip area in the mucosa. It's great to have you with us for Dermtube meeting coverage.
Thanks
from Maui Derm.